On behalf of Center for Equity Studies, we welcome all panelists. It's a rather somber moment. All of us have our own family, relatives, ourselves who are struggling with the virus. And at the same point, we are also trying to do as much as is in our power to help others at a time when, to an extent, as Arundhati has put it, we have been left to ourselves. In this time, in a certain way, the government may claim that, or some other supporters, ardent supporters of the government, may claim that this is at a time of tragedy. It is not a time to criticize the government. It is not a time to raise questions. But it is very much pertinent to raise questions at this point as to why have we reached where we are. It is important to realize amongst ourselves while we face this tragedy, while we try and help each other, while we go through this morbidity. It is important to recognize that the questions of freedom of institutions, autonomy of institutions, freedom of press, freedom of opinion, freedom of expression are not quote unquote elite concerns or concerns of the liberals that does not affect the world. I think the situation that we are in today, we have to recognize the fact that at a time when the media should have questioned that whether the government is taking adequate preparedness, whether the government is building adequate facilities. At that particular, precisely those months, we were busy investigating actresses in Bollywood for drugs. We were busy running hashtags on Riya Chakravarti and stuff like that. It is precisely those 3, 4, 5, 6 months that went by, and thereafter the election campaigns, and thereafter the huge gatherings, including the Kumbh, and misplaced complacency. And I think at a certain point, it is important for the citizens of this country to recognize that citizens themselves have a role, and that role of the citizens of the institutions is to keep our government to account. The large share of the fact that the government has remained this complacent to go to Davos 2 months, 3 months back and claim that we are at the best of preparedness, that complacency has been contributed by our conformity, by our silence, and to a large extent that complacency is built by crushing dissent, by not allowing critical voices, by not allowing media to raise questions. That is precisely why it is important to recognize this. At the same point of time, it is very, very important right now to move ahead. Move ahead in ways and means that we should. It is very, very important that we talk about how we move ahead from the situation that we are in today, whether in terms of our health crisis, what does it reflect on our broken health system, what does it reflect on our economy. We already are dealing with the crisis of the first wave. Where does the second, or what we hear of the third wave, is going to lead us in terms of economy? What does it mean for the poor and the marginalized? Where we are, why have we reached where is only one part of it? How do we move ahead? What ought to be done? What is to be done at this point and what should be done? What are the things that we pose, are questions that we must deal with at this point, as we even continue doing the firefighting. So it is with this idea that we are gathered here together with a very eminent panel. If I may request Harsh also to take the discussion forward about the particular theme today. This is part of the policy and inclusion debate series that we have been holding for near about 2.5 years now. And we earlier, as you all know, used to hold it in public, but since the pandemic, we are having to do it here. It is in partnership with the Rosa-Luxemburg-Stiftung and the NewsClick. I would request Harsh to very briefly introduce the panelists, if you may, and we may continue from there.
Thank you, Anirban, and my immense gratitude to both the panelists and the audience. These are very difficult and grim times. We have sat together, I think, even a year ago and in between. But at this moment, I think looking around us, we're seeing our republic in a state of collapse. We're seeing governance completely broken. We're seeing each of us are watching bereavements, loss, fear, bewilderment. It's difficult to open your phone because you're worried about whose news you're going to get receive. We're seeing, literally we're seeing bodies piling up onto the streets, people choking for oxygen. And I would like to underline actually the ongoing more hidden suffering of the last year and a quarter of an economy, a shrinking economy, of hunger, the crisis of hunger, of joblessness, and that is also something that we need to, and the breakdown of hope, the breakdown of trust. I think we're seeing ultimately the wages of governance, which I would say, stick my neck out, governance of extreme, immense hubris, spectacular incompetence, and almost pathological absence of compassion, even just elementary compassion. The panelists, I know that we have a lot of webinars, but I'm grateful that we made the time. And most of the discussion that we will be doing today will be forward-looking. What can be done, both about the health crisis and the economic crisis that we confront, and what is it that we can do to make some of this happen in a situation where where governance seems to have, as I said, completely broken down. But with it, the whole idea of an accountable governance. I wrote a piece a couple of days ago saying that this collapse of the institutions that should hold the executive accountable one by one. These we have watched, and many of us in the middle class have consented to the collapse of each of the institutions, the judiciary, the media, an independent civil service, professionals, and public, most importantly, political parties, public dissent. All of these have been systematically crushed. And that is why we see an executive which is so unaccountable, and that is where we've come to. I had promised my co-panelists, and I want to also reassure the audience that we would be looking for solutions. What is it that we should be specifically fighting for? But I did want to give one very quick round to all of you in the panel to say, what went wrong? I mean, I think that question, we still cannot run away from that question. How did we come to this place? And if each of you could just literally spend a minute saying, what is it, what are the headlines of what you feel went wrong in our republic, in the world's largest democracy? What is it that has led us to, being in worse place vis-a-vis the institution, vis-a-vis the pandemic, vis-a-vis the economic crisis that we are seeing. So just, we'll just this one round about where did we go wrong. May I start with Sujatha Rao? Sujatha was one of our very respected health secretaries. She's also, got an impressive academic career, but she's a very caring and outspoken person, and somebody that in the last days I've been reading her commentary as well. So just a quick headlines of where did we go wrong, Sujatha?
I think, to be very quick about it, we didn't really learn the lessons that we ought to have learned from wave one. The virus was kind enough to give us a little window. That was, say, October, November, December, January, February. And those were crucial months when we could have learned, implemented all those, interventions that we found as big gaps in wave one and strengthened ourselves for wave two. Wave two should have been expected, not only because the scientists had been warning the government that there will be a wave two, but even if we didn't think about our own scientists, both US and UK had both shown that the pandemic was coming in waves. Italy, France, they all went through a wave two, wave three, and it was equally lethal. So to have expected that we have controlled the virus and there was nothing else to worry was a bit naive, and we just fell into a self-created complacency, and I think that has cost us wave two.
Thank you, Sujatha, and we'll what could have been done, I think, will also be reflected in what needs to be done as we move ahead. Prabhat Patnaik is here with us, one of our most respected economists. Speaking out, he and Jayati have been very strong voices for public policy and economic policy, which is more humane, equitable, and just, and for universal social rights. Prabhat, what would you, in a minute, say? What has brought us to this point of suffering, collective suffering?
As Anirban pointed out in his original introductory remarks, I think, to my mind, the basic problem is the total absence of any means of accountability of government. It has systematically destroyed all means of accountability of the government that is essential in a democracy. Whether you take the press, whether you take the visual media, whether you take the judiciary, all of them have been basically enfeebled, because of which the government is not really accountable to anybody. They can just do anything and they can do nothing. And as a matter of fact, even as far as the public is concerned, I do not think things are perhaps changing after the recent elections and so on. But even as far as the public is concerned, the government does not consider itself accountable because it believes that as far as the public is concerned, before the elections, if that temple comes up in Ayodhya, or there can be something they can do, something they can engineer, because of which they were able to get that. The usual constraints upon a government, whether it is from public opinion, fear of getting re-elected, not getting re-elected, and of course the continuous pressure that is there from the press, media, and the judiciary, and all the other instruments that function in democracy, all of it is gone, because of which he can do anything he likes, and he can do nothing. And as a result, we are in this kind of a situation.
Yeah. The failure of all countervailing institutions of democracy, which could hold the executive accountable, I think that's what you're saying. All of them have collapsed. And And to that extent, it's been a crisis long in the coming, well before the pandemic came to us. I mean, I think that we need to recognize that. I move now to Dr. Vikram Patel, an old friend, but much more than that, a public health intellectual of considerable standing. He's actually joining us from Harvard, from his office room, I think in Harvard. Vikram, just a quick analysis of where we've gone wrong.
So I want to start, Harsh, by completely agreeing with both Prabhat and Sujatha, and I won't repeat what they've said. I think, if I have to add to that, I think it's a sense of exceptionalism that has pervaded our country for the last few years, that somehow we're a special, different or unique people, different from everyone else. That our rich history and culture and a variety of other unknown factors somehow make us invincible in ways that Americans, Italians, Brazilians, and others are falling. I think we have failed to bring in a very important discipline in our conversations, which is history. 100 years ago, India was hit by a similar coronavirus epidemic, which also hit us in multiple waves, and which the second wave killed millions of Indians. I think we have also failed to look at the questions about the quality of our leadership. Let us not assume that the three worst affected countries in the world that are in completely different continents, the US, where I am currently, which was hit very badly in November last year, Brazil, which is currently going through a terrible wave, and India. I don't think one has to be a rocket scientist to figure out what unites these three countries that have led to a humanitarian crisis, which in my view is not because of the virus, but because of the quality of the leadership that all these three countries currently suffer. Well, not currently, the US thankfully no longer suffers that.
The quality of leadership, I think is spot on, and that is why that's what brings, ironically, three of the largest democracies together into autarkies, which are unaccountable in multiple ways. Dr. Jayati Ghosh is with us again from, she's taught in JNU, I think, for 3 decades, is a very important voice again for equity. And she's, I think, now teaching in Massachusetts, and grateful that you've joined us. Jayati, your quick headlines on what went wrong.
I think it's been beautifully pointed out by the previous speaker, so I'm not going to repeat, but I just want to emphasize that, yes, this is a crisis long in the making, that already we had a very weakened health system, etc. But the current wave is a created catastrophe. It's not just one of negligence or complacency or not doing something in time or prevent. It is, of course, entirely preventable, but I think worse than that, it has been created. It's been created by super spreader events. We all know them. It's been created by active dismantling of even the little that was put up in the first wave in terms of available health structures and medical facilities. And it's been created by the unwillingness to accept any kind of advice, including from its own scientific bodies, as we are now hearing. So yes, I think these all stem from the more fundamental issue that Prabhat mentioned about the lack of accountability. And it's only greater accountability that's going to force some change, I believe, in the current policies.
Thank you, Jayati. Yeah, that this was a created calamity, I think is something that is very important to remember. Finally, last but not least, I go to Dr. Sundararaman, with whom actually I worked in many different capacities. I've had the privilege and learned a great deal from him on the questions of equity in more generally, but also equity in healthcare. Sundar, where would you say we've gone so terribly wrong?
I think we went wrong from the very beginning. It just came to roost now. I mean, the whole thing came to this now. The story of every epidemic is actually the story of the interplay between knowledge, ideology, and politics or power. When the first few months opened out, just justified by knowledge and justified by a certain sense of ideology, there was this whole superlative lockdown that was created. A complete a dream world for a fascist, where you have absolute control over every single leaf that stirs, so to speak, along with a constructed narrative, a narrative of having successfully stopped community transmission, of being the best nation in the world, of having a control system. So here you have a system where you have actually controlled entire movement, and you have entire controlled media, and you are able to create stories of 1 lakh beds have been created. When you're really repurposed beds, really no few new beds were added on upon that time. You have been able to actually do that. So while at one point we are seeing a great reliance on the public systems, however weak they were, while we are seeing a call for public health goods, on the other hand, given the authoritarian state, you found a huge degree of privatization across all sectors. Right. It was almost a free license to move, and what is incredible is that they would move it even in the health sector. But across all sectors, you found a license to actually go the way of the thing, and a complete short shrift to equity, a complete almost as if that no longer matters because even the more powerful were threatened by the disease. So you had those whole scenes of the migration. So the first 3 months set the pace. After that, it was much more the dependence so much on the management of headlines that the management of the pandemic actually failed in front of the. So very good at the headlines management, very good at maintaining the narrative, and therefore many of the basic things that they even stated they would do were not done, and therefore the second wave just sort of ripped it all apart and left it so exposed that we are gasping for air, literally. It's really a tragedy of how the whole thing has moved on that. Really said that at one point, something which is so far-reaching and far-sweeping, you can't deal with this with the disease control program. You need an actual manifesto that is based on some fundamental principles of how we are going to reconstruct this, how we are going to look at it. And what you had was not even a disease control program. You didn't even have an interim disease surveillance program of any depth in place in the months in between that has happened. So that's been the real tragedy of it. But it started with the way the first months that it's the scientific argument about the lockdown or not having the lockdown is a different thing. But what it did to the nature of the state is, I think, what really, really undermined us.
Thank you, all of you. I think I think we have a very strong picture of where we went wrong. I would just like to perhaps just underline one or two more things. I think that we the absence of any sense of responsibility of the state to provision basic public goods like healthcare, education. Social housing, clean water, and of course education is something that we need. I mean, there's a culpability that is much older that we need to see, and how whatever public health arrangements we had have been systematically dismantled over the years. And we have probably one of the lowest funded public health programs in the country. But even, and 80% of trained doctors in the country, and this now still doesn't exclude, I mean, it's a great underestimate because those who travel abroad and are working abroad don't come in. But even those present within the country, 80% trained doctors work for the for-profit private sector. And so we are left with, and their contribution to responding to the pandemic has been based, I mean, the most generous estimates say they contribute about 10% to responding to the pandemic, but I would say that a lot of it is based on still preserving private profit, in fact, maximizing private profit. And I see that even in terms of oxygen provisioning, in terms of vaccine provisioning, the government seems much more concerned in recognizing and protecting private profit, even in times of national emergency, than equitable public provisioning. And I think that background, the absence of labor rights is something else that I thought that we needed to say, that 9 out of 10 workers in India still function and work with no protections whatsoever. I think are important in addition to the particular character of the government that we have today, and it's absolutely spectacular failures. The fear I think that many of us are feeling in our hearts when we hear about, we're still to peak, that there's going to be a third wave, maybe a fourth, and how many of us, how are we going to survive as a nation through all of this? I think is a question that is no longer rhetorical, but with a sense of great immediacy. And I think that is where I would like to move the discussion now. The discussion really is, as we had all agreed while planning this discussion, what are the things that need to be done? And just for convenience, I thought we, in the first half of this discussion, we talk about the area of public health. The only exception is Jayati, because Jayati has to actually go to a WHO Council meeting, and she'd have to leave us. So I'd invite Jayati to talk about the larger picture first, and then each of you, taking a little more time, what do you still feel can be done now? We've reached this place. We're seeing bodies piling up. We're seeing the kind of desperation. I would like to also, I'm sure this panel doesn't need reminding, but I work with the homeless, and they're not even part of the story at all. I mean, they're not even testing them. The idea of the possibility of them getting any kind of testing, quarantine, oxygen is not even being imagined. And I think that what should be done for the poorest to be able to access healthcare is something that must concern us. Just for illustration, the Delhi government said they have a policy of home quarantine, and so they wound up whatever quarantine facilities they had. And I said, what about people who don't have homes, or people who live in one-room shanties? Where will they go? How can you not create facilities for them? And they've done nothing about it. And I think that the fact that public policy is clearly designed in our country, that there's some lives that need to be protected. When the Prime Minister tells us to stay at home, you have to have a home to keep distance. You have to have space where you can have distance, to work from home, that you have jobs that will pay you while you stay at home, to wash your hands, you have running water. The fact that the large majority of people were did not have these meant that the protections were not even in principle available to them. So the lockdown was not even in principle protecting the people who carried the highest burdens of the consequences of the lockdown. What do we do looking ahead for repairing our health system? And Jayati also, the whole question of the economy and hunger and joblessness. So Jayati, maybe start with you, please.
Thank you so much, Harsh, and apologies for taking the time first, but as Harsh explained, I'm going to be very brief because I know there will be many more important and valuable suggestions coming from the others. I think the first thing to do is to stop the damage. I'm saying all this in the not in the expectation that this government will actually do it, but that these are demands that must be raised very urgently, and with luck, some of them could be implemented. But stop the damage in terms of stopping the disaster capitalism that is playing out in very extreme form in India today. We have the most obscene disaster capitalism in the world. There is no other country that is charging people for vaccines, charging differential rates to center and state. It is everywhere, even in the most capitalist countries of the world. It is seen as a free vaccine for everyone. So I think vaccine production and distribution, it can be ramped up. There are public sector units that could have been licensed much earlier and can still and must be licensed. I'm told 3 are already being told to, but there are another 8 that could easily ramp up production. Other medications and treatments, I think the production and distribution of vaccines and treatments has to be immediately taken over centrally and managed in a way that would ensure universal access. So that's number 1 priority, obviously. Immediate compensation and social protection. We've talked about this so many times since last March. The need to provide adequate food to everyone, a universal food access program, not one that depends on your ration card. And it can easily, we've also talked about how this can be administratively managed. Provision of at least 7,500 rupees a month to households as income support. I would say it's not support, it's compensation, because it is the government that is depriving people of their incomes and livelihood. Expansion of the employment guarantee to every adult, minimum 100 days per person in every district, creation of an urban guarantee. There are many ideas and workable ideas that are already put up there. All this obviously requires much more money also being made available to the state governments. Once again, GST compensation dues are delayed, and yet state governments are being made to take the responsibility of everything, including all of the various things that I have outlined. So immediate expansion of resources, all of this can simply be financed by the government spending right now, immediately. In the medium term, there is a scope for much more taxation of the very wealthy, the extremely wealthy who have doubled or tripled their assets and incomes over this period, and a very small wealth tax, less than 4%, on 0.001% of the population, just the top 2,000 families, would actually double the total health spending of central and state governments. So we are talking about things that can be done quite easily with the political will. The fiscal stance has to become much more expansionary. We are one of the only countries in the world and among emerging markets that has not had an aggressive public fiscal stance. And as long as we do that, as long as we keep containing our incomes, we're going to get a further economic slide, a further collapse in incomes and livelihood, a further decline in investment, and employment implications that will be beyond even the catastrophe that we're seeing today. These are all things that can be done. These are all things that this government shows absolutely no inclination to do. But obviously, we need much more public demand and outcry to generate this kinds of change.
Thank you, Jayati. I think that's a very comprehensive and thoughtful list. The question that we'll come back to later is, how do we make this government actually listen to us, or people like us? Arundhati Roy has sort of recently written that please step aside. You're just not capable of delivering. Short of that, what can we do in these times for the most elementary kind of steps that Jayati is speaking about? In the context of the homeless, I just wanted to say, even right-wing capitalist governments, during the lockdown, I asked my friends what's happened to the homeless during the lockdowns in London, and they said they're staying in hotel, and they're saying 5-star, 7-star hotels. Every hotel has been booked, and homeless people are living there in safety, paid by the state. It's an imagination. I mean, I don't know when India would have a time when we would have homeless people being kept at Taj, in the Continental at state expense, and seen as something that the state has a duty to do. Sundar, let me come to you next. Just what in terms of the health crisis in particular, I mean, for the rest of you, we'll come to the economic crisis in the second half in greater detail. I know that they cannot be separated very strongly. But just, what do we do about oxygen shortages? What do we do about bed shortages? What is possible in the short run? We're not even thinking about the medium run. What can we do while the second phase and the third phase, which is coming, and people are dying and gasping for breath? What can be done? Sundar. Sundar, you're muted.
Sorry. There are two ways to actually bring some traction on this problem. Two ways which we have to go from two different sides. One, which I think is what really, from a civil society public point, which we have been pushing. In fact, the National Human Rights Commission has issued an advisory on this. The JSA has asked for this. It's a simple demand. The demand says that if a person is sick and he comes to a public hospital or calls a helpline, then it is the absolute duty of the hospital to admit him and give him at the appropriate level of care, because there are 3 levels of care, appropriate level of care, and provide him the care that is required. If there is no bed, because then you build on, if there is no bed, it is the duty of the hospital to shift the patient to the nearest place government bed which is there and admit him there. And if there is no government bed, then you requisition the private hospital beds which are available under the reimbursement terms that you negotiate with them, and you are able to provide them that particular care. And you may need to help the hospitals gain their certain level of things. And further, when it comes to the first level of care, which is what is basically the isolation, but not the severe care, you can requisition even hostels and community halls, etc., which you can do. Now, this is not an impossible demand. In fact, in Chennai, it is happening now. And they are struggling. I think they're about 70% of ICU beds they are able to get found. So you don't have the person run from pillar to post and have to negotiate his own auto or vehicle and then go and by that time fall sick. Which also means that the state gets committed to building this network and being able to enforce this thing. They are having a problem, and I know that the officers in Chennai are doing a good job here, but they're having a problem forcing some hospitals readily come forward to part with number of beds. Some hospitals require a certain degree of pressure. And for some, you must use the damn NDA, MA laws that provide this power to you. You use it to public shame people on the streets, but you don't use it to actually enforce and requisition capacity where capacity is shared. But it's a doable proposition. And at some point, it comes along with the stuff. However, there are deeper supply side problems. So oxygen, for example, it's not the total manufactured volume of oxygen that is the problem. Oxygen manufacture is not such a big volume, but it is its logistics. It's a very tricky logistics of the containers, moving back, filling up, the limitations in storage place. And when everybody has maxed this, all of a sudden, they have maxed the degree of consumption. Now, that requires a very good degree of nodal center, which takes over and is able to commandeer resources, be able to allocate, but be able to do it along with a certain amount, as far as they can do it in a decentralized way. So states like Kerala, Tamil Nadu are relatively doing better. Though Tamil Nadu has had 2 incidents on this, but it's still better. But at some point, you have to use that level of logistics to be able to supply, because we are in a disaster situation. The ideal is not this. The ideal is a situation where you have a surge capacity, an inbuilt excess capacity, a capacity that makes it so-called less than efficient. But when you are faced with a disaster, it is not only this disaster, it could be a local disaster, a flood, a tsunami, earthquake. And that place, the public system is able to expand to take on that particular role. But right now, since there is no such capacity, since public systems are built on the basis of minimal thing, that you provide the minimal services that you are able to provide, and the rest you leave to the private sector. That's been the organizing principle of all public health services in India since the 1990s, that everything is designed in a minimalist way. And then but a disaster is a maximal event. It's an event that puts stress on even the optimum. And that is designed on a minimal conditions can never cope with something that's a maximal event. Like we say in disaster management, if you can't cope with one house collapsing, how the hell can you cope with an earthquake when all houses will collapse simultaneously? At some point, what you have is therefore is certain issues of basic design and principle and policies in health systems building, but you also have an immediate problem over here. And the way out of it is, to my mind, to start from a health rights issue and say that if a person reaches a hospital, go ahead and do whatever it takes to make sure that everybody is admitted in. And the message I'm saying is it's doable, and there are situations where it is happening. It's not going to be easy to do that in UP, but it is far better than what is happening there. So if you can actually move it forward from this. Similarly, on the whole private sector regulation and rights, it's obvious, it's all over the place. People being charged 1.5 lakhs and bodies not being let loose, and very often given totally inappropriate care and then dumped onto the public system when they are no longer able to pay. This is flagrant. It's happening across the place. You need to bring in community level monitoring systems which are able to bring in, at least at the district level, joint monitoring teams that can prevent such arbitrary, inappropriate care and overcharging. But at the same time, you're providing the option of private sector joining in it. The good news is there is some in Chennai. There are 350 private hospitals they are dealing with. About 60 to 70 are coming in very voluntarily. The rest require a certain degree of persuasion. But there are the hardcore nuts who don't come in on that. But you can therefore make a much greater, if you are very clear that this is to be treated as an entitlement, that the poorest person who makes a phone call into a helpline shall be admitted into a hospital with the minimum level of care if they require that. It's possible. And we are talking of ICU and tertiary care. It is possible. It is possible in the here and now to a large extent. It's still going to be stressed. You're still going to expand the need to expand capacity, but it's the way to go. And see these as essential obligations of the state. Non-viable obligations that the state is in a position essentially to fulfill and should use its powers under these acts to fulfill it. The Jan Swasthya Abhiyan has just brought out as a resolution that lists 12 such obligations, which are basic core obligations that the state has, including things like the safeguarding of civil liberties, that stop victim blaming and shaming, public shaming of individuals on this, including this 12 basic obligations that the state should provide in the nature of rights thing. That is still, rights-based approaches are seen as sort of, woolly approaches which are very idealistic. It's not so. You are starting from what's a clear entitlement, and then you work backward and see how the supply side gaps can be reached as a short-term measure, as an emergency measure. Maybe in Bihar, you will need to bring in foreign doctors also. Maybe you will need to ask Medicine Sans Frontiers and ICRC to Russian teams, because you can put ventilators there. How are you going to teach them skills to actually manage that ventilator? And the ventilation that this disease requires is a very sophisticated form of ventilation. It's not the ordinary ventilation that the average respiratory paralysis will manage with. So you would need to, as a stopgap, take all international assistance, national assistance to cope with the crisis. But eventually, you know that when that foreign assistance leaves, you must be able to replace it with the Indian thing. Otherwise, I see that in the northern states, you can have a complete disaster. We already are in a complete disaster. So I don't know what I mean by that we can have, but yeah, it is somewhere there.
Sundar, I mean, I think that was really comprehensive. I couldn't agree with you more in principle, but looking around, I mean, I see, I was watching NDTV and they were very respectfully talking about how Max and Apollo hospitals, etc., are contributing so much to the vaccine, campaign. They're charging 600 rupees, they're charging 1,200 rupees. There seems to be, Mr. Poonawala says, this is a time for me to maximize profits. So in a time, in the kind of neoliberal governance that we have, without the resources and the personnel who are in the for-profit sector, we cannot run the ventilators, the ICUs, expand hospital beds. But how are we going to get them and provide back universal vaccinations? How are we going to get them in an environment where it seems more sacrosanct that they have every right to preserve and expand their profits rather than use this as a moment of national emergency where they have duties? So Sujatha, would you like to come in? I'll then ask Vikram the same question.
So, the first thing is that to control the pandemic, it is not just enough to do jumbo hospital approach. That's very, very important. Right now, I believe there's a huge fire and we all have to, first of all, douse it. So there is no question of running away from the fact that people who need treatment, whether it's ICU or oxygen-assisted hospitalization, that has to be addressed topmost. But having said that, I think since, we are, it's not going to get over so quickly, and there will be, maybe the intensity may ebb and wane and come back again and so on, what we need to quickly put in place are community approaches. That's what really got Africa, Sierra Leone and Liberia, for example. Ebola pandemic was stopped only because of community effort, not because of the $1 billion huge sophisticated hospitals that USAID put up. So, the problem is that no community, the entire civil society effort has been so minimal. People's participation has been so minimal. And largely it is because they're still running around opening SBI accounts at FCRA and so on. So I think the first thing is for the Prime Minister to say all that is on hold, forget about it, get what funding you're getting, what donations you're getting, what resources you have, and send the signal to the state governments to start beginning to use civil society and the communities very actively. And a part of the community is obviously the local bodies. So unless and until they are totally engaged, and if they are totally engaged, I believe a lot of the primary care and a lot of the preventive, not only preventive work, but even those who are falling sick require isolation, require food support, require a place where they can isolate themselves, and if they're slightly breathless, there are now oxygen concentrators that can be quickly put in place and they can be helped. So I think, or proning or whatever other techniques there are to help them to get back their oxygen and get stabilized. So stop people from getting into the running around hospitals. They can't get vehicle support. Huge amounts they're paying on getting transportation to get to the hospital. And this needs to be addressed. And largely this is in Bihar and UP. A lot of people are dying harsh in the rural areas only because of this one single fact. We don't see them because they're hidden from the public view and the television cameras. What we see is happening in the cities. So I think this is the first thing, is to really get the people moved to take care of this triaging and developing an action plan to encourage and facilitate those initiatives. The second is, of course, as you said, the vaccination. I'm sorry, but they bungled the whole policy so badly. I think the Prime Minister must take a very close review of it. And now today, US has said they will not stand in the way for IPR. That's a very good morale booster. I know it takes time for that to kick in, for the WTO to come into place. But whatever it is, there is now a global resolve to say that we have to help the low LMICs and countries like India. So I think if vaccination in 2 months' time, if we can get our production up, and we can easily do, 1 crore vaccinations a day. I don't see any problem in that. And I think that it has to be done free, or as is today, where your nominal fees may be charged by the private sector, 100 rupees, 200 rupees, that doesn't matter. So I think the vaccination policy needs a review. And the third, of course, is there's so much of black marketing, whether it's transportation, whether it is the drugs. I'm amazed that we don't have a standard operating protocols and procedures for how to treat the 3 different stages of COVID infection. Now that we have been dealing with this for a year, there's enough collective wisdom to tell us when to use remdesivir drug, when to use or not to use other drugs, and when and not to use CT scans. I can't understand why we are not able to formalize that, publicize that widely, and get the medical associations to begin taking action against those doctors who are unscrupulously prescribing CT scans at a drop of a hat, or forcing patients to pay 30,000 rupees, 40,000 rupees for the remdesivir vial when it's not really needed. So these are some of the measures, I think, which are causing a lot of pain, and these need to be addressed very, very quickly. And last, I would say, but not the least, I have been telling the government, I have seen both in polio and HIV/AIDS, the kind of what the mass campaigns, information campaigns can do for bringing in behavior change. I have not seen that kind of campaign in our country. Where do you have? You just have Dr. Guleria coming in every TV show and giving us clarifying FAQs. That's not a campaign. A campaign is very different. It's very designed. It's a multi-pronged strategy. And I'm just amazed that when we have that huge capability, why we are not. My problem, I'm sorry to say, but I have a feeling the government of India is very stingy. They just don't want to spend any money. And they're just hoping that this pandemic will just blow away, and some CSR here, a donation there, and somehow the other will just manage the headlines and get done by. But they're not really investing in these fundamental and core things of having a transparent ways of handling the pandemic by engaging every Indian, whatever class or creed or wherever he is, and every lever of government to come together. We've done that in the past. The polio is a big example for that. And we know what to do. We know how exactly those strategies have to be formed. And I fail to understand why that is not being done. And I just hope there are these 4 or 5 interventions that if they could put in place, it will give a great amount of relief for us to get over this present crisis.
Thank you so much, Sujatha. Community involvement, much greater public spending. These are some of the things that clearly need to be done. Vikram, once again, my problem is that we have a government which seems which is neoliberal at an extreme level. The most capitalist of countries around the world are saying free vaccines. They're looking at provisioning of basic health, at least in this time of global emergency. Our government doesn't seem to be doing that. How would you feel that what do we need to do in the immediate?
Thanks, Harsh. So first of all, I wanted to just completely support what Sundar and Sujatha have just said, and I will not repeat that. I think it's important for us at this point in time, this particular moment in our history, to recognize that the immediate priority is saving lives. Let's be very clear on that. I think there will and needs to be a time for accountability. There is no question that what this pandemic has done has exposed long-standing structural faults in our healthcare system and indeed in our overall governance. I'm sure Sundar and Sujatha will agree with me. This is not a new problem. The issue of profiteering in the private sector, the lack of coordination of healthcare, the creeping in of neoliberal capitalist ideas in how healthcare is treated in India as a commodity for the rich and as charity for the poor. This has been around for like decades, ever since I came into the field. And I think, to be honest, what the pandemic has done is simply expose the raw brutality of such a fragmented system. So let's, instead of focusing on how we fix these problems that have been around for decades, think about how we can save lives. And I completely agree with Sujatha that actually India's greatest health successes have not come from high-tech medicine. And let me tell you this, Harsh, one of the most important lessons of this pandemic has been how we all rushed to privilege the high-tech hospitals and ventilators and ICUs, when in fact we now know that 99% of people who suffer this infection, maybe 99.5%, never need to be in an ICU. And the tragedy that we're seeing in India right now is not the lack of ICU. What we're really seeing is deaths that could have been totally averted and avoided by low-cost community-delivered intervention. And Sujatha is absolutely right. In this madness of what it is that families are seeking to achieve and get for their sick relatives, we have forgotten that the most life-saving interventions that they should be accessing cost very little and can be delivered outside hospital, often in your own home, with fairly low-cost technologies. So I would suggest that the immediate priority is to equip our frontline workers, our primary care physicians, our district hospital level providers with the necessary knowledge of these low-cost evidence-based interventions. And I know that there are many groups doing that, both groups in India like the JSS and Seva and others, but also with an extensive network of emergency physicians and pulmonologists from around the world who are directly working with them. And I'm hoping by next week, in fact, some of these authoritative clinical guidelines will be out. Let's be clear also that although the horse may have bolted in places like Delhi and Mumbai, in fact, the epidemic is still making its way into some of the poorest, most remote and rural regions of the country that have the least health resources. And we can do a lot to save lives even now by empowering frontline workers in these parts of the country with information and, of course, very importantly, with the low-cost technologies that they will need to save lives. I also wanted to say something, beyond the life-saving interventions that I think we should focus on, is that there are also people with non-COVID related health issues, and we have to make sure that we don't ignore them. One of the very important lessons that came out from the unbelievably brutal lockdown that we suffered in March last year is that there were more people dying during the lockdown period because essential health services for mothers who had to give birth, for young children who had to get treated for their infectious conditions, etc. There were more people dying because of the completely blinded approach of shutting down essential health services for the sick, people with cancer, people with heart disease, etc. So I would say another important parallel strategy is to make sure that essential life-saving critical care services for people with non-COVID related medical conditions is not halted because of this pandemic. One more thing about the pandemic itself, Harsh, one of the most important things that we're not seeing coming out of our country right now is transparency about the essential biomedical information we need in order to track the spread of this disease, but very importantly, to track the evolution of the genome of the virus. There are increasing concerns around the world that India is a global health security threat. Let's be clear about this, not only to our own people. People are watching the catastrophe in India from around the world, but recognizing that the lack of transparency on data is threatening the whole planet, because these variants are not going to stay within our borders. They're already across the borders in Nepal, for example. And so it's very easy for them to travel. And I think I would really say that this is a time for ICMR and the government science bodies to completely open access to the data, the treasure trove of data that they have on the spread of the pandemic, as well as on genomic data on the virus. I want to just end by saying one more thing about, we've heard a lot about, the lack of leadership in the center, etc. But I'm wondering, Harsh, whether this is a time to simply work around that. I'm wondering whether this is a time to work directly, as Sujatha has said, with civil society groups. I'm wondering whether this is a time to work directly with districts, because that is where the real action takes place, or at least at a higher level with states. We've heard from Sundar about the work being done in Tamil Nadu, and actually there are some very inspiring stories of collectors, of NGOs, of state governments that are taking a very different route. So rather than just look at New Delhi, and by New Delhi, I mean not the state government, but the central government, can we not maybe just simply work with people on the ground who are accountable, who are compassionate, who are going to be informed by science? And with this, I will close by simply saying, I call on our government to completely deregulate the FCRA Act. There are thousands of people around the world who want to contribute either in cash or in kind to NGOs and to other civil society groups. And currently, the much more restrictive rules of the FCRA are making it even harder at this time. If this is a humanitarian crisis that affects all of us, this is something you can do right now in an hour, is to deregulate the FCRA so that aid can rush in the way that, for example, Sundar described in UP and Bihar. This is not a time for nationalism. This is not a time for arrogant pride. No, this is a time to open our doors to help from anywhere and to make sure that the organizations that are grounded in our communities are able to access that help immediately.
Thanks, Vikram. I think there was a lot of wisdom. I mean, transparency on data, deregulation, community interventions. I mean, working with the homeless, for instance, in Delhi, I found it really hard to get permission or get a space from government even to test, to quarantine. There's, not just the resources, even the permissions are very hard. And it's a strange kind of, we won't do it, we won't let anyone else do it. And of course, receiving resources. It has to be, it's a national emergency, the biggest health emergency in a century. And there are wonderful people across the country who want to intervene. And at least that should be facilitated as well. So we have a private sector which is non-profit, which is, and that needs to be enabled. I think that is what I'm hearing from all of you. Before we come to Prabhat, and I think that's, shifting the last part of our discussion a lot to the economic crisis of hunger and joblessness and the contracting economy. And I think that's going to take a toll when all of the health problems, the phases 2, 3, 4 may pass. But this is something that we're going to live with for probably much longer. The Right to Food campaign, of which I'm a part, and the Center for Equity Studies decided to do a quick hunger watch survey, and we want to do a series of them. The first report is ready. I request Deepa and Rajendran to very briefly tell us what they found about the situation of hunger, and then I'd have Prabhat to respond, both releasing this report formally, responding to it, and then contributing to the second part of our discussion, where in the time that we have left, what can we do to deal with the economic crisis that is facing us? So, Deepa, Rajendran, who would come in first?
Yeah, thanks, Harsh, and thanks all the panelists. What we'll do is we've made a very short presentation based on the report. We'll quickly run you through the presentation. I'll start, and then Deepa will take over.
While it's coming on, just to say that the survey was done in September, October, but we thought this is a good time to release the full report because we are again seeing these micro lockdowns and similar conditions.
Right. Thanks. So, yeah, so we spoke to nearly 4,000 households across 11 states, and the number of respondents were equally split between urban and rural areas. And what we tried to assess was we tried to compare the situation as to what was before the lockdown was announced, which is March 2020, then what was it in the months of April and May 2020, followed by when the survey was done, which is in October 2020. And our focus was on, we wanted to look at specifically how the vulnerable communities are coping with the entire post-lockdown scenario. So one of the important things we want to say is that it's not a representative survey in that sense. However, what we do see is that whatever our findings are, they are in congruence with multiple surveys that have been put out by various universities and various survey agencies over the last year. So the profile of respondents, we had about 30% were Dalits in our survey, and about 29% were Adivasis, and about 20% were Muslims. And nearly 78% of all the respondents were earned less than 7,000 per month before COVID. And across all key parameters that we tried to assess in this as part of the survey, what we found was that the urban respondents were at least 15 percentage points worse affected than the rural respondents compared to rural respondents. And what was really shocking was that 1 in 4 Dalits and 1 in 4 Muslims reported facing discrimination even at this. Now, before I proceed, I just want to say one quick thing is that situation was terrible even before COVID hit us, because there are multiple nationally representative surveys that highlighted how the unemployment levels were really high and the consumption was at its lowest in the last 4 decades. It had plummeted to its worst in the last 4 decades between 2012 and 2018. So that was a condition in which we went into the whole national lockdown scenario. And we're just presenting some very broad parameters. The details are in the report. So compared to the situation in Feb-March 2020 and in October 2020, what we found is that 27% of the respondents had no income in the month of October, who were earning a reasonable amount of money, not a reasonable, but some amount of money prior to the lockdown. And then 40% reported that the nutritional quality of what they ate became much worse. There were categories like worse and much worse, and we are talking much worse. Even the quantity had decreased a lot. For 28% of the respondents, the quantity had decreased a lot between Feb-March 2020 and October 2020. And about 48%, nearly half of the respondents, had to go to bed at least once without a meal in the month preceding the survey. And about 1/3 of them had to skip meals sometimes or often. And again, nearly half of them indicated that their need to borrow money just to eat had increased by for about 45%. And the consumption in terms of the commodities of consumption, we saw that the maximum people got rid of eating eggs and meat, followed by green vegetables, followed by dal, followed by rice. So this was the order, in a way, the pecking order, if you will, that eggs and meat were the first to go out of the window. And just to give you a sense of numbers, a conservative national estimate of the informal workforce in our country is about 330 million. And what we are saying is that akin to, this is like saying, and a majority of our workforce informal workforce has been facing some kind of this level of severity. And what we are saying is that this is akin to saying that the combined populations of Germany, France, United Kingdom, Italy, and Spain, which is about 325 million, have been pushed to the brink of hunger. That's the scale of hunger we are talking about. Over to you, Deepa.
Just quickly, the last two things we wanted to share was what we found. We didn't have too many detailed questions on access to the support systems from the government, but we asked about the main schemes. And the findings were fairly encouraging in the sense that we saw that 70% of all our respondents, those who and our respondents all belong to marginalized communities, they reported getting their usual entitlements of rations. 75% had ration cards. And then among those, they were all having different kinds of ration cards. We asked those who had the cards under the National Food Security Act if they got the free grains which were given up to November, and almost 90% reported that they received the free grains. In this also, it's important to note that, and we have the detailed tables in the report, that one is where we find that the impact and the situation of food insecurity was much worse in urban areas. In terms of coverage of PDS, it was much better in rural areas. So possibly this was one of the things that worked in providing a cushion to those in the rural areas, in the sense that they had an access to PDS, and a number of them had an access to also this additional 5 kilos of grain and 1 kg of dal for free. But that was only for 6 months, and that was ending the month we did this survey, during which time, like we can see, the situation is still quite bad. In the month of October, So this was not as good in terms of midday meals and ICDS benefits. Only about 57% of school children and 48% of ICDS beneficiaries, which included pregnant and lactating women and young children, reported getting some form of take-home rations or cash in lieu of food in October. So these schemes had still not really taken off even 6 months after the lockdown. Given this context, we had made certain demands, Rajendran, if you can go on, which we think are still very relevant now again in today's context, both because the situation was already bad, like the Hunger Watch and many other surveys are showing, and like all the panelists have been saying, this time the second wave is not just confined to urban areas or big cities. You see the virus spreading to rural areas, so there is both the health burden as well as the livelihood and food burden continues. The first, of course, demand remains to have a universal PDS, which includes not just food grains but pulses and oil. They have just announced 2 months of free grains alone, and again only for those who have ration cards. So the problem of those who do not have ration cards is quite severe. That needs to be taken care of, and we think universal is the only way. Even if we look at the NFSA coverage percentages based on the current population, then about 10 crore people are excluded from the PDS on the basis of what the Act promises. So there is definitely a need for an expansion of the PDS. And the free additional grains which have been now announced for 2 months is obviously not enough. The economic revival will take much longer. And therefore at least 6 months. And again, this is a very achievable demand because there are 80 million tons of food grains in the FCI godowns as we speak today. In the ICDS and midday meals as well, for so long as Anganwadi centers and schools can't reopen, to make arrangements for take-home rations or cooked meals to be distributed at home. Again, this states like Kerala have already done, and including items like eggs in them. Expanding the Narega to at least 200 days per household, having an urban employment guarantee scheme, and cash support in various forms. We have social security pensions for the old people, single women, disabled persons. We have maternity entitlements for pregnant women. Expanding these, front loading them, giving higher amounts, at least 2,000 rupees for pensions and the entire 6,000 rupees in one go for maternity entitlements, without limit on number of children. Additionally, special COVID relief grants like they were given last time, although they were very small amounts, that needs to be repeated for all the pension holders, Jandan account holders, and so on. Some amount of cash support also even more necessary currently because health expenditure is also rising. So I'll just end here, and we were hoping that this could form the basis also for the next part of the discussion, which is on the economic and food crisis.
Thank you, Rajendran and Deepa. This is a very rich report. We felt that we needed to keep reminding ourselves and policymakers about the ongoing crisis, humanitarian crisis of hunger and joblessness, which we will keep trying to do. We felt it was very fitting that Prabhat would formally release the report. I don't know how you do it on an online, so we'll just take it that he's released it. But it also seamlessly takes us into the second part of the discussion. I know that we're running against time, but we'd like to hear Prabhat both responding to the report, but also to the economic recession and what it means for the poor and what needs to be done. I'll come for final comments to other panelists. I request you to also look at a number of questions which have come in, and you might like to respond to some of the questions as well in your closing remarks. Prabhat, over to you, please.
Thank you. I think it's an extremely important report, and I congratulate those who are involved with bringing this report out. You know, the unemployment problem was already very serious even before the pandemic struck. It was the worst in decades, the unemployment rate that we had in the country. And the pandemic, of course, worsened it. And what is quite remarkable is that even after the lockdown was over, the unemployment situation continued to go from bad to worse. I think there is an aspect of it which we have to keep in mind. When we were demanding, Harsh, you were involved in that demand in a very big way, that during the lockdown, every household should be given 7,500 rupees per month of cash support. Universal. Now, that was not just a relief expenditure. Of course it was. Of course it was. But additionally, it was also a means of stimulating the economy after the lockdown was over. Now, this is an aspect which at that time the government did not notice, the government did not care about. And in fact, the amazing thing is that there was no such universal cash support. So it's not surprising that even after the lockdown is over, recovery of the economy continues to be badly hampered. That that, that basically, if people have had no financial support during the period of the lockdown, they tend to borrow, as we just saw. And they tend to borrow, then after the lockdown is over, they want to pay back some of those loans because they have to. And as a result, their demand, in the absence of an increase in their employment and income, is likely to be particularly constrained. And when it is constrained, there is no increase in demand, there's no increase in employment, there's no increase in income. And as a result, the recovery of the economy continues to be stifled. And this is exactly what has happened. As a matter of fact, if the government during that period, for several months, had actually given 7,500 rupees as everybody was demanding at that time, in that case, by October, the employment figures and the income figures and the consumption figures would have been much better. So the fact that they are worse is something which really does not come as a surprise. It is actually a confirmation of the fears one had earlier that this cash support is not only for relief. Of course it is, it would provide relief, but additionally it's a very important means of recovery of the economy. Now, since we are talking again of a lockdown, many people are talking about a national lockdown. Even if there's no national lockdown, there are local level lockdowns and so on. It is extremely important, as happened in the United States, that any lockdown must be associated with two things. One is that there must be a stipulation that there is no eviction of anybody in the period of the lockdown. Whether you pay rent, whether you don't pay rent and so on, there's simply a moratorium on evictions of anybody during the lockdown. And the second is, of course, the handing over not only of food rates through the PBS and, of course, universal PBS, but what is more, also cash support. Just make a calculation. If you actually gave 7,000 rupees for every household, even for a period of about 2 months, it would not really come to very much. It'll come to no more than about 2% of the GDP. And even if the 2% of the GDP, no taxes are raised for the time being, are simply deficit financed, it would be absolutely no strain on the economy. The economy can easily take the strain. So the idea, I think Sujatha referred to the government being stingy. Perhaps it is stingy, perhaps it is scared and unnecessarily scared, excessively scared of the reactions of financial markets. The financial markets don't like fiscal deficits, which is why the government actually wants to cut back on its expenditures in a way which is, I think, quite criminal. To starve your people in order to please finance is, to my mind, a really criminal activity. The other very important point that the report has thrown up is really the comparison between the rural and the urban. Whenever we talk about a period like this, we always imagine that the rural areas would be the worst hit. But what the report says is that actually in urban areas, things are even worse. And that's really quite surprising to start with, on the basis of the kind of knowledge of the Indian economy that we had in the earlier period. But I think one of the reasons, I think Deepa provided an explanation for it, but I think one of the reasons must be that in rural areas, the employment guarantee scheme played an extremely important role. I mean, really, if it was one lifeline that the country had during that period, it was the employment guarantee scheme. while the absence of an urban employment guarantee scheme has been a really crippling fact as far as the economy is concerned. And therefore, we must demand that there should be an urban employment guarantee scheme, just as we are demanding an expansion of the rural scheme to cover not just 100 days of employment, but much more than that. Likewise, we must demand a universal employment guarantee scheme covering both rural as well as urban areas. And I think that is something that should be immediately on our agenda. There are many other very interesting and important things about the report, but I don't have time to go into it. But I'd like to congratulate the authors of this report for their findings.
Thank you so much, Prabhat, for your words. Actually, you have been saying, we have been supporting the idea of, if we in the middle class in the formal sector were getting salaries for staying and at home, at least minimum wages should have been paid to all persons. It would not have cost a great deal, and I think the damage to the economy by complete shutting down of demand would actually have been greatly compensated. I mean, the damage would have been much less. The distress would have been much less. Universal PDS and an expanded PDS and a universal employment guarantee scheme are three things that you have been talking about, and somehow it does just not. I was hearing a discussion by Nobel Prize winning economists on NDTV, and I found the poor so marginal to their discussion, by and large. They were saying the government is doing well to revive the economy. Yes, the poor could, like, by the way, and somehow we need to put the suffering of the working poor in this crisis at the center of our revival plan. I think that's perhaps what we need to say most. I know we're running against time, and I'll come back to the other panelists just for final closing comments. I'm also drawing attention very briefly to some questions. What is it that can be done to prepare for the third wave? Some people are calling in for the army to take responsibility for oxygen for health provisioning. What do you think about that? What do we deal with states where the state is filing FIRs against people who complain about the lack of oxygen? Can we have the nationalization of the health system? Would it help? It's something I've been talking about for ensuring availability of health personnel. There's a question about, isn't the crisis also rooted in the weaponization of the federal system for BJP political gain? And haven't Tamil Nadu and Kerala gone their own way because they know they can't expect from the center? And very importantly, I think the question of how do we repair our society, how do we ensure, how do we repair our democracy? Those are bigger questions. How do we make accountable the executive? So those very small questions, and the economic crisis, and Prabhat's remarks. Just some closing remarks from all of you. I wish we had more time. Vikram, would you like to come in?
Thanks a lot. I'll be very brief. I want to take the very last question about long-term healing, which I also think is relevant to preparing for the next pandemic or the third wave. Harsh, as I've written recently, there is a real trauma that is sweeping across our country as millions of stories of suffering, despair, and death are really affecting each and every one of us. And there's a real, there's a sense of helplessness, because the comfort that we've always had, no matter how failing the government has been in the past, currently there is a real sense of that the government itself has evaporated. There's a real sense of a collapse of the state. There's a sense that there is a massive lack of honesty, transparency, and therefore a total breakdown of trust between the people and the state. And I think, of course, we heard about the first lockdown. I think that was certainly one of the, milestone events that led to the breakdown of trust. But what we're seeing right now is horrifically much worse. And I believe that, I draw parallels. This is not the only country, which has had such a catastrophic humanitarian crisis. As others have said, one can really clearly say this is not the virus, but it is the failure of governance. And I think, for long-term healing, I draw inspiration from other countries and other places which have had similar awful humanitarian crises to say that the only way that we can actually heal as a society, rebuild the trust that we need between ourselves as a people and the governments that we elect, and of course also prepare for the next pandemic, is a form of an independent accountability commission, a commission that is empowered with all the information that it needs from the government, that would document the facts. And this is not about, let me be clear, this is not about holding an individual or a group of people to blame. This is not about that. It's actually a path towards restorative justice, to heal a very deeply wounded nation. And of course, this is not for here and now, but I think we need to begin that process now so that information is being collected. This is about long-term healing. This is about rebuilding our nation, not about holding an individual or a group responsible for what has happened. Because let's be honest, there has been a failure of governance at many, many different levels, including, Harsh, and I'll stop here, my own community of scientists who also, I think, have a lot to explain about why or what we did to preempt this disaster that has unfolded.
Thank you so much, Vikram. And I think that's something that we need to take away. How do we heal trust? And now people just don't believe. I mean, the government says something one day and then says the opposite. We won't have a lockdown, and suddenly you have a lockdown. It's a lockdown only for 1 week, and then suddenly they keep extending it. Nobody believes the government. There's no transparency. There's no data. There's no accountability. But I think there's a breakdown of trust also again with your employers. Ravi Srivastav was talking to me once, and he was saying that labor knew they were exploited, but they believed that when things really got bad, the government and our employers would protect us. And what they have seen is that when things got really bad, they were willing to throw them to the wolves. And I think it is that breakdown of trust also in your employers. And they've still come back in large numbers because they didn't have options. But they came back without even trust. And I think that what that would mean for our society is something that we need to think about. Dr. Sundararaman, would you like to give some closing comments?
Yeah, I think one of the real challenges now is how do you bring back the question of equity to the center of governance? And the problem about it is that there is this large feeling of we don't care about the majority. It's about really planning for the privileged and the elite that dominates the thinking of planning. But ideologically also, I think there's been a shift where you are really talking of more privileged sections demanding bothering about the erosion of their privileges. And therefore, it's going to be a very uphill task to actually bring about a change where the politics is directed towards improving the lot of the majority of them. I think that's one of the central problems, that even when the crisis is on us, even actually the vaccination policy we had just before the recent one had its problems, but it was still at 250 rupees in any private hospital or free in government hospital with a complete public procurement and allocation across states, was still essentially a process where equity could have been built in. With more outreach and affirmative action, the potential for equity was there. And then we gave it up. We gave it up completely and just jumped into a program where the only logic could be profiteering for a capitalist who is willing to accept that at some point he is already making a good profit and he is only talking about the scope of super profits on that. And why did we abandon a policy that was actually had the potential to develop for a policy that has no potential? And how can we be so, where is this impunity factor coming from? The fact that you can be so blatant in trying to make profiteering something which is acceptable. This is something very difficult to understand. And I think this is going to be the challenge at some point. How do we raise the political consciousness to see this? This is the problem with the present governance.
Thank you, Sundar. I think that again is very valuable. We seem to assume, I mean, we can have Mr. Poonawalla saying, this is my time to make super profits. I mean, this is a time of national emergency. This is a time that he needs to cover his costs, maybe, yes, but not a time to make super profits. But it's something that people have accepted, and equities completely disappeared. How do we change that, I think, is the question. Sujatha, for your final comments, and then I'll come to Prabhat.
Well, when it comes to third wave, see, whether it's a third wave, fifth wave, or 10th wave, we all know how this virus behaves, how it gets transmitted, and how it is infecting. We know much more about it than we did last March or April. So there are only two ways. I wouldn't even give washing hands and maintaining distancing such a big priority, because it's so impossible for a majority of our people. But certainly wearing a mask, it can be. And that social discipline and complete ban of events which tend to have crowding should be enforced ruthlessly, no matter what the price is being paid. So if we can just do these two, data shows that almost 70% of the infections can be averted. Just the mask can avert an infection. So that is where I think the best bang for the buck, as they say, is possible. And in this, there is a certain amount of leadership, and there is an amount of political will that is required. To hell with the religion. As late as yesterday, you found those people in Gujarat carrying pots, and those Christians getting together, and the Eid over here, chock-a-full, the what is that called? The Charminar area, chock-a-full with people. This has to be brought down with an iron hand, and I think the political will has to be very clear and unambiguous on this count. That's one. The second, I would say, is the vaccination policy has to settle down. And I'm afraid the mindset of the current government is for monopolies, is for profiteering, and has some very funny understanding of center belonging to Prime Minister Modi and the states being somebody else. That's not me, that's not my people, that's you. So somehow that has to go, and I'm not too clear and sure, because I know the way it's being worked out, the policy in Delhi is by a small group of people he has a lot of faith in. And he's not known to be very open and, open to ideas and open to inclusive in his approach. And it's difficult for a person at the age of 70 to change suddenly. So the only way probably this style of governance can change is by media and the Supreme Court coming down heavily, because the foreign press is doing as much as they can in shaming us, and he's very sensitive to international image. So I'm sure they're having their own impact. But even in our country, these are two institutions that have to save the country. The third is the parliamentarians, the opposition. It's ridiculous for the opposition to keep whining. I haven't seen any, there are, after all, how many, 200 MPs who are not BJP. They can all get together, give signed memoranda. They can put pressure on the Prime Minister that these are the standing committees should meet. The Parliament must convene. We have to discuss ways and means of how to get out of it. We have to act as a united voice. Why is it that they're not able to do that much? So the point is, political action, I find, is extremely weak. And just keep on whining about it is not going to help. I find even the opposition MPs not forcing, and I'm sure that if the opposition people were to talk to many of the BJP MPs, after all, many BJP MPs are facing the flag in the field. They're seeing what's happening. All that needs to be announced is an all-party committee of parliamentarians, 24/7, to be scrutinizing and making the executive accountable. Today, the executive is not accountable to anyone. How is it that 167 oxygen plants are sanctioned 8 months ago and the tenders are being still called? It's unacceptable. We have all worked in the government. It doesn't happen. So, I think some amount of accountability of the executive to be done as far as oxygen and drugs and all that is concerned. This has come as a huge shock right now. So it takes time to readjust and recalibrate. I have a feeling by in another 10 days, things will settle down. I'm sure about that. That doesn't worry me so much as, and we've learned a lesson. I'm only hoping that in four things, the Supreme Court, the media in India, the parliamentarians, both BJP and the opposition. And the fourth thing is, if you notice of the wave one, it really hit the migrants and the poor and so on. So the middle class got away banging thalis. It didn't really seem to worry them because it didn't affect them. But in this wave two, it has gone into our homes. It has become such a big issue on the television media and everywhere is only because the middle class has been badly battered by this wave two, which is not nice, but it's a good thing that's happened because now they are the constituency that the BJP is afraid of, the Prime Minister is concerned about. And so they are the ones, I think their voice is going to matter. And I do hope that they demand better accountability from the government to take measures. But let's hope for the best. You saw today the principal advisor coming out warning loudly about wave 3. If only had done that about wave 2, we wouldn't have been in such a mess. So, people are finding courage because it's really hit them hard where it matters. And I'm more optimistic about our ability to handle wave 3. And let's hope for the best. I think we just need to join hands and see that we don't suffer or minimize the suffering as much as we can.
Thank you, Sujatha, for your optimism, but also for the reminder that these institutions need to hold the executive accountable, the Supreme Court, the High Courts, the media, middle class.
The High Courts are doing a splendid job, Harsh.
Yeah.
Amazing. I think, people like you should do some more advocacy with the Supreme Court judges and all. Some are very fine people, Narimans and Chandrachuds and so on. So, let's hope that they hold the government more accountable.
I don't know whether Harsh has that sort of powers.
I don't know. I mean, well, these are our tools that we have. We have to just maximize what we have with us.
Thank you, Prabhat. Your final closing comments, and then
I'll be very brief. You see, the fracturing of the nation, of the abandonment of equity as a principle guiding the nation is something which really began a long time ago. It began with neoliberalism. As you know, the inequality in the country has gone up enormously since the neoliberal measures were introduced. But of course, in the other countries, particularly in the Western countries, the pandemic has been an occasion when there has been, if anything, an effort to recapture the concept of a nation, to recapture the concept of equity and so on. I mean, for instance, you look at Biden's economic program and so on, very clearly, he is talking about taxing the rich in order to provide greater employment and so on. But on the other hand, in our country, precisely the opposite has happened. Namely, the pandemic has been an occasion for actually further accentuating an inequality which was already growing in the neoliberal period. Now, the thing is that one very obvious example, as I think Sujatha pointed out, is the fact that, look at the vaccine prices. What was the argument for suddenly abandoning the earlier policy? And you look at agriculture. There is a commission on agricultural costs and prices that looks at the cost of production of the farmers, and on the basis of that fixes the price. Here, we have no price fixing mechanism. It's just left to a duopoly of firms to really determine and dictate whatever prices they wish to charge to the state governments and to private hospitals. So this is an absurd situation. I mean, this is something which really defies reason how this can actually pass as policy in a country, because you have to, where again I emphasize the absence of accountability. So I think one point where we can begin is actually, to recapture, if you like, that sense of a nation, the sense of equity, one point where we can begin is actually by making vaccines free for all. If the central government does, as it did, monopoly procurement of all the vaccines from all producers and simply distributes it free, even through private hospitals, I calculated the total cost would be more than 36,000 crores, which is 0.2% of the GDP, which is a trivial sum. So what's the problem? And that, however, would actually put an enormous amount of faith in the people, in the society, and so on. And also, it would be an effective counter to the pandemic in the present context. The other thing which I want to talk about is that it's a scandal if you have the FCI with 80 million tons of food grain stocks and with growing, which this report has marvelously brought out. It's a scandal. And I think this should be highlighted. And in fact, even earlier, you remember they had about 100 million tons of food grain stocks when the first lockdown happened. Some of it was distributed, which is why in rural areas at any rate, you had some kind of prevention of disaster. But on the other hand, the fact that 80 million tons are still there and hunger is growing is a scandal and an abomination. I think we ought to really demand this expansion of PDS, expansion of employment guarantee, universalization of employment guarantee, and so on, highlighting this scandal and abomination.
Thank you so much, Prabhat. In the end, bringing back equity, but I also feel bringing back fraternity into the way we think about public policy, that is perhaps the biggest challenge. I just recall again, while you were speaking, Gandhiji's, a few months before he died, the talisman he left, that when you're in confusion, think about the poorest and the most vulnerable person you know, and think about the policy choices you're making. Is it going to benefit her? And I think that if we held on to that talisman, we could not have had the national lockdown. We could not have done a lot of, the profiteering that we're talking about now. The obvious, things like free universal vaccination for all would naturally emerge. So reclaiming the ideas of equity and fraternity in our constitution, in the imagination of our nation. So thank you for that, Prabhat. And thank you all of you for this. I thought it was a wonderful discussion. I really wish our policymakers would pay some attention. But I think this clarification of ideas, even within ourselves, was very useful for the demands that we need to make to each other together, and the healing that Vikram talked about, the accountability of the executive through various institutions that Sujatha talked about. Thank you for all of these. And I finally hand over to my young colleague, Varna, to give a vote of thanks.
Thank you, everyone, for joining our discussion today. And we're highly grateful for all our panelists for giving us maybe a small possibility of hope in this very, very difficult time. I got my first vaccine shot today after having spent many hours on the Karwan website looking for one shot and finally having to go some 45 minutes away from my house to get my vaccine. It is very clear, even in the slightest interaction of the current health system, that there is the utter abandonment of equity on all fronts. And I'm very grateful that this was pointed out multiple times through this discussion. We had a similar seminar last year around this time, and ironically, but not surprisingly, we discussed almost the same points, from conversation about rampant hunger, the need to expand the PDS, the need to bring in Urban Employment Guarantee Act. And sadly, we continue to make the same demands, only now with the pressing need to address a health emergency immediately. Thank you again, everyone, for joining us. I want to remind all of you that the Hunger Watch report is available in the website of the Right to Food campaign and in the Center for Equity Studies' website. We hope you join us in our further discussions, and I hope you all stay safe and stay healthy.